Cocaine is one of the most powerful and dangerous psychoactive substances known today. Its ability to produce intense euphoria has led to widespread abuse despite well-documented risks. Exploring exactly how it creates pleasurable sensations, the progressive damage it causes, and the devastating personal and social consequences of its use. The human brain contains a sophisticated reward system designed to reinforce survival behaviors like eating and social bonding. This system relies heavily on dopamine, a neurotransmitter that regulates pleasure, motivation, and reinforcement. Normally, dopamine is released in response to rewarding stimuli, briefly activating neural circuits before being reabsorbed by transporters in a process called reuptake. Cocaine disrupts this delicate balance by binding to dopamine transporters and blocking reuptake. This blockade causes dopamine to accumulate abnormally in the synaptic cleft, leading to excessive stimulation of reward pathways, particularly in the nucleus accumbens, a key structure in the brain's pleasure center. The result is an artificial, overwhelming sense of euphoria far more intense than natural rewards produce. Beyond dopamine, cocaine significantly impacts other critical neurotransmitter systems. It increases serotonin levels, contributing to short-term mood elevation and reduced anxiety, but chronic use depletes serotonin reserves, leading to depression and emotional instability. Cocaine also blocks norepinephrine reuptake, inducing physiological arousal, including increased heart rate, blood pressure, and alertness. While this contributes to the drug's stimulating effects, it also elevates cardiovascular risks. Repeated cocaine exposure alters glutamate signaling, the brain's primary excitatory neurotransmitter. Over time, this leads to long-term potentiation in reward circuits, essentially rewiring the brain to prioritize drug-seeking over natural rewards. These neuroadaptive changes create the compulsive cravings and loss of control, characteristic of addiction. When consumed, whether snorted, smoked, or injected, cocaine rapidly enters the bloodstream and crosses the blood-brain barrier, producing effects within seconds to minutes. The immediate physiological responses include significant cardiovascular strain, as cocaine acts as a potent vasoconstrictor, increasing blood pressure and heart rate while reducing coronary blood flow. This can trigger heart attacks even in young, healthy individuals. The central nervous system becomes hyperstimulated, with users experiencing heightened alertness, reduced fatigue, and increased motor activity, though this may progress to tremors, seizures, or hyperthermia. Smoking crack cocaine can cause acute lung injury, while chronic snorting damages nasal cartilage and may lead to perforated septums. Long-term cocaine use inflicts severe systemic damage. The cardiovascular system suffers chronic hypertension and arterial damage that increases risks of aneurysms, strokes, and cardiomyopathy. Neurologically, studies show cocaine accelerates gray matter loss in prefrontal regions, impairing decision-making and impulse control. The drug's metabolites place heavy strain on liver and kidneys, potentially leading to organ failure. Psychiatrically, long-term users often develop persistent paranoia and hallucinations, with cocaine-induced psychosis sometimes mimicking schizophrenia and lasting beyond abstinence. Severe mood disorders emerge as dopamine and serotonin receptors become depleted, resulting in treatment-resistant depression and anhedonia, the inability to feel pleasure. Cognitive deficits, including memory impairment, attention problems, and reduced executive functioning, are well documented in chronic users. The psychology of cocaine addiction involves powerful reinforcement mechanisms. The drug's rapid onset and short duration, typically 15 to 30 minutes, create a binge cycle pattern where each use reinforces the behavior through both positive reinforcement from the intense high and negative reinforcement as users consume more to avoid the subsequent crash. With repeated exposure, the brain undergoes significant neuroadaptation. Dopamine receptors become downregulated, making the brain less responsive to natural rewards and sobriety unbearable. Simultaneously, users become sensitized to environmental cues associated with drug use, meaning triggers like drug paraphernalia can provoke intense cravings even after prolonged abstinence, contributing to high relapse rates. The transition to full addiction is marked by loss of behavioral control, where users continue despite awareness of harm, prioritizing cocaine over health, relationships, and legal consequences. the drug becomes psychologically central to identity and daily functioning. The personal costs are staggering. Financial ruin from the exorbitant cost of maintaining a habit often leads to debt, job loss, and homelessness. Relationships erode through patterns of deception, theft, and erratic behavior that isolate users from family and friends. Legally, possession and distribution carry severe penalties that can include lengthy imprisonment, with collateral damage that disrupts families and perpetuates cycles of poverty. Recovery pathways, while challenging, do exist. Medical interventions include pharmacotherapy with medications like modafinil and topiramate, showing promise in reducing cravings. Emerging treatments like transcranial magnetic stimulation are being explored to restore prefrontal cortex function. Behavioral therapies remain cornerstone treatments, with cognitive behavioral therapy helping users identify and change destructive thought patterns, while contingency management uses positive reinforcement to encourage sobriety. Support systems, including 12-step programs and sober living environments, provide crucial community support. The neuroplasticity of the brain allows for partial recovery over time, though some cognitive deficits may persist. Comprehensive treatment addressing both biological and psychological aspects offers the best chance for sustained recovery, though the process requires long-term commitment and often multiple treatment attempts. The temporary euphoria of cocaine comes at an extraordinary cost. Neurochemically, it hijacks the brain's natural reward system, while physiologically, it damages nearly every major organ system. Psychologically, it rewires motivation and desire, and socially, it destroys relationships and livelihoods. Understanding these mechanisms in depth reveals why cocaine's pleasurable effects are not just dangerous, but ultimately illusory, offering brief artificial reward while systematically dismantling the user's capacity for genuine happiness and fulfillment. The most effective protection is complete abstinence supported by education about the drug's true nature and consequences.